Okay, well, good morning, everyone. My name is Karen Ball. I'm the owner of Pronoeo Insurance Agency, your health insurance broker of the group. And I have the pleasure of giving a presentation today with my cohort, Leo Alberigi, our elder law attorney. And we decided to give a presentation on the upcoming changes for Medicare and Medi-Cal. People get Medicare and Medi-Cal confused a lot of times. They don't know which one's which or what they do. But hopefully in showing you how they can work together will help you understand the differences in what they are and let you know what the changes for this upcoming year will be. Okay, so you can have Medicare and Medi-Cal at the same time. And when you do, you're considered a dual eligible individual. So Medicare, you have to be age 65 or older or be disabled at any age. But for Medi-Cal, your income has to be under that 138% of the federal poverty level in order to qualify for Medi-Cal. Medi-Cal also has some asset requirements that you can't exceed. Basically, you have to be poor. You can't have more than $2,000 in liquid assets, in cash for an individual, or $3,000 for a couple. But you can keep, your home and your car, your personal belongings, things like that don't count towards those assets. They're just looking at liquid assets. So the slide I have here is a little out of date. This is from 2012, but it does show you that that there are just millions of people who fall in that dual eligible situation where they are maybe over 65 but still are low income, and so they can qualify for both programs.
And when you're dual eligible, it also applies for if you're qualifying for long-term care Medi-Cal, because Medicare will be your primary if there's an acute care situation that comes up. Recall, or I should say, that long-term care is not considered acute care, although some individuals may think that it does. As Karen will explain in a little bit, the Medicare will not cover for long-term care expenses. So for those who, as Karen just showed, fall into the challenged income situation or limited resources, they can apply for and probably will qualify for long-term care Medi-Cal. But currently, for liquid assets, your maximum asset limit is $2,000. Now, this is where it's a little different. If you're married and you're a couple, your max is $3,000. There may be additional assets limits for additional family members, but in here, that doesn't apply. But you do have what's called a CSRA, Community Spouse Resource Allowance, that if you're married, the non-institutionalized spouse or the at-home spouse can have up in his or her name up to $103,380 as of this year. And plus, in addition to those cash assets, as Karen mentioned, there are certain non-cash assets that you can have. These are called exempt assets. And if you look at it, it's pretty interesting. You can have you can own a personal residence. There's certain business real property that we call the 6,006% rule. That means that that you're taking out so much equity that the value that's left is $6,000. And if you're renting it out, 6% of the rental income has to be netted per year. Jewelry for married couple is limited in value, $100,000 or $100 for a single person. Heirlooms unlimited. Personal property unlimited. So yes, in line with the waste removal theme, you can have as much toilet rolls stored, and that's not going to be counted against you. IRAs. IRAs are interesting. if the ill spouse is receiving an income stream from an IRA, then the principal balance of the IRA will not be counted. And of course, the non-institutionalized spouse or the at-home spouse's IRA will not be counted at all towards eligibility issues. Annuities, there's only one kind that's permissible. It's called immediate periodic annuity. That means you're annuitized the annuity, which means you're taking out a periodic income, either quarterly, monthly, yearly, and it has to be on an equal basis over a time frame that's less than what they call the actuarial life expectancy. So if you're 70 years old, and they don't really take health considerations in this actuarial table, but if you have time and you already have a hobby of looking up what your actual life expectancy will be, Social Security puts one out every year, and you can look it up on the net. And you look, if I'm 70 years old, how long do you expect to survive according to Social Security? And that will be the determination about how long your annuity can be. And of course, you can have a pre-burial plan. We call it pre-need, plus $1,500 earmarked for burial expenses. And I don't know why, but musical instruments are also not counted towards the asset limit. So if you're musically inclined, you're in good shape.
Go ahead, Leo, this is you.
Okay, so for Medi-Cal, and this is for dual eligibles, those who are in long-term care, the interesting change, it's set to come this coming July of 2022. No longer will the asset limit be limited to $2,000 for an individual. It will be increased so that the single beneficiary can have up to $130,000. So we're not just talking about indigent people. We're talking about those who are, doing okay, and maybe they're living paycheck to paycheck, but they got their head above water. Now they're going to be able to breathe a little easier, in terms of healthcare. And I think the idea, and I think Karen, you'll agree, is that they're trying to match those who are ordinarily limited by assets. They're trying to equalize the playing board so everybody can just be based on income limits rather than income and asset limits. And in addition, $65,000 for each additional member. So not just the spouse, but also if you have children and so forth, you'll get additional threshold increase of $65,000 per person. Presumably, for those who are in long-term care, the CSRA will increase at least to $195,380. I suspect, though, that it will increase more than that because that's a factor of both state and government formulas, and California likes to be very liberal when it comes to that limit. So it's what I anticipate the limit will be, but I think that it will be more than that. And by the way, these limits will increase over time so that the plan is, as of July 1st, 2024, in essence, there won't be any asset limits. It'll strictly be income, and that's huge. So in essence, in California, your incentive for investing in long-term care insurance, well, you won't really need it because the state of California has you covered. There are some downsides, though. Remember, with Medi-Cal, that you're limited to what they have available. So if you don't have a nursing care facility in your area, you may be assigned or may only be qualified for a place in Modoc County or Mojave, and that may not be, how should we say, your destination of first choice. So don't necessarily dismiss the private insurance idea, because if you want to have a place local so that your family can visit you on a continuous basis, then the private insurance option, or if you're affluent, you have enough set aside for private care, then you'll be okay. But with Medi-Cal, you'll be covered, but remember there are some downsides, and one of them is geography and availability.
Okay, so when you are dual eligible, Medicare is your primary payer. So when you go to the doctor, they send the bill to Medicare, but Medicare does not cover everything. There are deductibles and copays and coinsurance for your Part A and Part B, which is considered your original Medicare. And so anything that is not paid by Medicare is covered by Medi-Cal. I put here that Medi-Cal becomes the last payer for medical expenses, because if there is an employer's plan or you have purchased additional coverage like a Medicare supplement or a Medicare Advantage plan, those actually become secondary, and then Medi-Cal picks up what's left. But Medi-Cal does cover deductibles, copays, and coinsurance for fully eligible beneficiaries. When you become eligible for Medicare, you are required to enroll in a prescription drug plan. They figure at some, even if you're not taking medications now, at some point you will be. And so if you don't sign up when you're first eligible, you start accruing a 1% per month penalty. So when you do sign up down the road, your premium will be increased by 1% for every month you went without insurance. Now you can get a prescription drug plan either through a standalone prescription drug plan or through a Medicare Advantage plan that includes a prescription drug plan. If you are low income, there is a program called LIS, Low Income Subsidy, also known as Extra Help, that will pay the premiums for that drug plan. If you are not a, if your Medi-Cal does not cover you fully and you have a share of cost, then your prescriptions are limited in cost at $1.30 for generics and $9.20 for brand drugs. But if you are a fully covered beneficiary, then there is no cost for your medications. So there are 5 programs or 5 ways that you can qualify for Medi-Cal assistance. The one that everybody's familiar with is the income-based one. So if your income is less than 138 of the federal poverty level, you may qualify for Medi-Cal, as along with the asset restrictions that Leo went over. But also if you receive Social Security income and are either over age 65, blind, or disabled, you may qualify for that program. If you are over 65, blind, disabled, and medically needy, there is a share of cost Medi-Cal that's available. Although that one tends to be, could be more expensive than if you just purchased like a Medicare Advantage plan. Your out-of-pocket would probably still be a lot less than the share of cost. If you are over 65 and disabled and not receiving Social Security income, you may qualify for that program. Again, these are all income-based. They have different income level requirements. And the 5th one is the California Working Disabled. So obviously if you're disabled, but you are still able to work and your income is less than 250% of the federal poverty level, you may qualify for Medi-Cal. Some counties have programs that are called DSNPs, Disabled Special Needs Plans. These are Medicare Advantage plans that are designed for disabled individuals. And if you have one of these, there is no premium, no copay, no co-insurance. It covers everything. And we do have some of those in Sonoma County. Okay, where are we here? Oh, okay. So one of the biggest problems that we've had with Medicare is when you have been admitted into a hospital and have to transition to a rehab facility. It used to be that you had to be admitted into a hospital for a minimum of 3 days, and then Medicare would cover your rehab So that's changing a little bit in 22. You still have to be admitted into an acute care facility first, but as long as you are transferred to rehab during your benefit period, then Medicare will cover your rehab. So it doesn't have to be an immediate transfer from the hospital to a rehab facility. So in the hospital, Medicare, once you pay that $1,556 deductible, it will cover the first 60 days of your care in an acute care hospital. If you go to like a skilled nursing facility for rehab, Medicare covers the first 20 days. Beyond those limits, then you have daily copays. So a benefit period begins the day you are first admitted into a facility and ends 60 days after you've been discharged. So as long as you go into a rehab facility anytime in that period, you're covered. The thing that confuses some people is that sometimes you go to the hospital and the doctors just hold you a day or two for observation. Those observation days do not count towards your benefit period. So if you transfer to a rehab facility after you've been under observation and not been admitted to a hospital, Medicare will not cover your rehab. So Medicare does not cover anything that is not medically necessary. So you have to remember that phone and television and personal toiletries, things like that in your hospital room, they're not covered by Medi-Cal or Medicare or Medi-Cal, actually. So the only thing you need to be able to transfer to rehab is your doctor has to attest that you require intensive rehabilitation, continued medical supervision, and coordinated care from your doctor and therapist.
Yeah, and I just want to emphasize Karen's point there. If you have a loved one that's not cooperative with the medical team, which is primary doctor and the nurses and therapists working with you, and they're saying, hey, you gotta do these exercises or these other drills and so forth, and the patient's not cooperating, your Medicare is going to get cut off very quickly if you're not cooperative. And I've seen that happen on more than one occasion. So if you have a relative that's being stubborn, help them to understand that that the Medicare coverage will cut if they're not cooperative. So I do want to emphasize Karen's point there. I don't know if you have anything to add to that, Karen, but I'd seen that firsthand.
Yep, that's absolutely right.
And other changes that we want to go over, of course, this is with respect to Medi-Cal that's coming up, effective in a couple of days. Individuals with a Medi-Cal share cost, and basically share cost is a co-payment. This is what you're expected to pay out of your own pocket before Medi-Cal benefits kick in. They'll be mandatorily enrolled in a fee-for-service Medi-Cal. Today, individuals who have a Medi-Cal share cost and who reside in one of the 7 CCI counties, or what they call a county organized health system, are enrolled in a Medi-Cal plan to receive their Medi-Cal benefits. And it's these individuals, they'll be transitioned out of their Medi-Cal plan into a Medi-Cal fee for service. And this change impacts both individuals who are dually enrolled, meaning for Medicare and Medi-Cal, and individuals in Medi-Cal only. So the idea behind this, I believe, is to pass a little bit more of the cost to the individual, but overall, the design is to try and save money, for the government. Karen, I don't know if you have any comment on that, but that's I think the rationale behind the change.
Oh, I think you got it, Leo. That's it.
Okay. The next change, and these are for non-dual eligible Medi-Cal enrollees without a share cost, and some dual eligibles will be required to join a Medi-Cal managed care plan statewide. And basically what that means is they're defaulting these individuals into a partnership plan. And in Sonoma County, Karen, correct me if I'm wrong, but I think it's Partnership Health Plan of California is the primary provider for Sonoma County. And I think there's 13 other Northern California counties that That's the main conduit for the state partnership plan. But are there any other partnership programs that you're aware of out there besides the partnership health plan?
No, actually, I'm not aware of that.
Okay. And again, this is beginning in a couple of days, so the transition's happening, and hopefully, according to Medi-Cal eligible beneficiaries, they were supposed to receive notice of that, so they should not be surprised by the mandatory change. Okay, third, and this is interesting. So starting in a couple of days, Medi-Cal plans to begin to offer what's called enhanced care management and community support services. That was previously known as in lieu of services. And ECM, or enhanced care management, is defined as an extensive whole person care management program that will be available to those individuals, get this, with high needs and high costs. So in other words, these are individuals that are basically high maintenance for healthcare purposes. And so the objective ostensibly is for coordinating care, addressing social hurdles of health, and improving health outcomes. And who's this tailored to? This is tailored for people who have been experiencing homelessness, high utilizer adults, those with serious mental illness or substance abuse disorder. No, and it's interesting to me, not a majority, but a significant amount of this population are those who have PTSD. They're veterans, and unfortunately falling through the cracks. They are experiencing homelessness. They're addicted. They have substance abuse issues. And I think this is an outreach to try and help those individuals. Hopefully it will have some success. We'll have to wait and see. Okay, next slide. Okay, as of July, as I mentioned before, the asset test will significantly increase for the aged and disabled, medically needy with a shared cost, and long-term care individuals receiving Medi-Cal. It will increase from $2,000 to $130,000 for an individual. And if there's an additional family member, $65,000 for each additional family member. And eventually, then the asset limits will increase to $130,000 for the Medicare savings program. So that's pretty significant.
And these are the Medicare savings programs. There are 4 of them. As you can see, each one has a different income limit to it. The only one that pays for premiums, deductibles, and copays is the qualified Medicare beneficiary. So you have to be at the 100% of the federal poverty level to reach that. The others pay for the premiums for either your Part A or Part B. Under the qualified individual one, it's significant to note that Medi-Cal individuals are not eligible for that program, even though to be on Medi-Cal, you have to be under the 138% level of the federal poverty level. Qualified individual one is not available to Medi-Cal beneficiaries.
Just about a minute more, you two.
We're almost done. We've got 2 more slides.
Great.
Okay, so basically the Medicare savings programs that we were just looking at pay for the out-of-pocket expenses of premiums and cost sharing. But as we've been touting through the whole presentation, the asset test will be fully eliminated for these programs by 2024, July of 2024. And as Leo had pointed out earlier, the purpose of these changes is to level the playing field. Right now, someone signs up for Medi-Cal through Cover California, there are no questions about assets at all. So there's no restrictions, no requirements, no anything. But if you're over 65, there are. You have to fall into all of those asset requirements. So that's what they are trying to do, is level it out so Right now, if you're 64 or under, there's no asset requirements, but 65 and over there are. So they're slowly eliminating those too. So nobody has any asset requirements to qualify for Medi-Cal. And we are done. Thank you very much.
Yes, thank you.
Nice to have the joint presentation. If you have questions for Karen or Leo, reach out and make a one-to-one. We'll continue on our rest of our meeting to get you out of here. And now we're going to have our